Hello students, welcome back. So today we are going to discuss on the topic hospital and its organization, which is there in your subject pharmacy practice included for final year B Pharm. Now these are the contents which are being mentioned in your syllabus. Moving to the first one, introduction. What is a hospital? So as we all know, hospitals basically provide us with various facilities, maybe for diagnostic purpose or it can be for surgical purpose. Now we are having so many equipments, or you can say so many facilities in the hospitals like x-rays, ultrasound, ECG. So these have all become an integral part of the hospital. Now coming to the definition, if we want to define a hospital, we can define it as an institution of community health or a specialized complex organization. So which makes use of the physicians, there will be nurses, there will be surgeons as well as a team of technical staff. Now all these provides facilities for the diagnostics, therapy, rehabilitation, prevention, education as well as for research purpose. So in simple terms, we can say a hospital is a healthcare institute which provides the patient treatment along with some specialized medical and nursing equipment so that the patient can be cured. Apart from that, it also has facilities for diagnosis, therapy, prevention, education and research. Now, organization structure is something which is there in hospital. Now, in simple terms, if we see what is organization structure, we can say these are the levels of management within a hospital. Now coming to the functions of hospital. Now everyone must be familiar with what are the functions of hospital. You all can write your own functions also. So the main function is what? Basically to cure a patient. So hospital provides the population with a complete health care. Second, it provides medical care for the patients. Third one, we are having some hospitals which include medical colleges in that. So they also provide teaching for the vocational, undergraduate, graduate as well as postgraduate students. Apart from that, they also have to maintain some research facilities. Then it lowers the incidence of disease through early detection and treatment. So if a person is having a particular disease, if he visits a hospital, that particular disease can be prevented from spreading further. Coming to the classification of hospital, now there are various types. So if we classify hospital, you all can see first one is on the basis of care. Now what is the meaning of the basis of care? Like first is primary hospital. Now primary hospital will be having a very basic health care treatment for the patient. So they will be focusing on the simple ailments, not the complex one. Okay, so in the primary hospital there is the first contact of the patient and the doctor. So if we see an example of a primary healthcare hospital, we must be very familiar with the PHC or the primary health center, which are there in every part of our country. So this particular primary health center is a part of primary hospital. Now in the primary hospitals, we are having various things like there will be care for the mother child, there will be family planning, there will be immunization, then treatment of some common diseases and other issues. Now coming to the secondary hospital. Now secondary hospital refers to the second tier of health system. Meaning here the patients will be transferred from the primary to the secondary hospital for their treatment. So these include district hospital, community health center at the block levels. So it is in between the primary and the tertiary. Now coming to the tertiary hospitals. Now these hospitals are having sophisticated instruments and they are referred to a third level of health system. meaning all the facilities will be provided in the tertiary hospitals like the Tata Hospital. Okay. Now here the patients are usually consulted either from a primary hospital or from a secondary hospital. So whenever a patient visits a particular hospital, you all must be familiar that the patient is generally advised to shift to another hospital if they are not having those facilities. Okay, so if the person visits a simple hospital in his village, that will be a primary. Then he comes to a town, that will be a secondary, and then he moves to a bigger city for his treatment, that is tertiary. Now second classification is on clinical or non-clinical basis. So under this we are having again two types. One is clinical, second is non-clinical. So under clinical again three types we are having: medicine, surgery and maternity. So under medicine we are having pediatric, psychiatric, nervous disease, okay, TB, general medicine. Under surgery, we'll be having orthopedic, gynecologist, ENT, and maternity, which is either short term or a long term. Now, non-clinical basis, we are having government and non-government hospitals. Government hospitals like Army Hospital, City Hospital, Navy, Civil. Non-governmental, we are having some private hospitals which are run for profit. Then there will be church hospital, non-profit hospital, community hospital, etc. Now, third classification is based on the size. Okay, so first you'll see large, then there comes medium, small, and very small. Now, large hospitals are those which are having a bed count of 1,000. So, those hospitals which are having 1,000 beds, they will be classified under large hospital. Medium hospitals are those which are having beds between 500 to 1,000. Now small hospitals, they have bed somewhere in between 100 to 500, and then comes very small hospitals which are having beds less than 100. So based on the number of beds, this is the classification. Next classification what we are having is based on the cost, based on money. So under this we are having only two types: elite hospital, budget hospital. Elites are those which are having higher technology and advancement in their hospitals. So obviously the cost will be more. They are having some deluxe rooms in them, so that the cost is automatically increased. Now coming to budget hospitals, those are very moderate budget hospitals or low budget hospitals, like a general ward can be classified into a budget hospital, whereas where you are paying thousands of rupees to have a single room in a hospital, that can be classified as a elite hospital. Next is based on the system of medicine. So this is the last classification of hospital based on system of medicine, meaning what kind of medicine will be given in that particular hospital. So again we are having allopathy hospitals, Ayurvedic hospitals, homeopathic, Unani, nature and veterinary hospitals. So all these things are included in the types of hospitals. Now moving to the next part, organization of hospitals. Now, organization is basically a dynamic process wherein there will be various activities from people that come together to perform a particular task. Now, the most important body of any hospital is the governing body, or you can say the board of directors or board of trustees. Now, these are the people who either run the hospital. Now they comprise of various personalities in the field of medicine, education, research and administration. Basically there it is a group of people who come together to run a particular hospital. Now the main job of these people is for framing all the rules, regulations of that particular hospital. Now this is the structure. So there will be a board. Under that comes the administration. Under administration we are having information service, who will be looking after admissions, billing, etc. Therapeutic service, OPD, outpd, nursing, pharmacy, diagnostic service, medicinal labs will be there, cardiology, neurology, support service like the housekeeping staff, maintenance, okay, transportation, everything. Now again, this is a similar board, you all can go through this. Now coming to the organization of hospitals. Now as we saw, this contain administrative staff, there will be a medical staff, associated medical service as well as supportive paramedical staff. Now coming to the administrative staff, that is the first one. So the administrative service of a hospital are controlled by a chief executive officer or a president. Now what is the responsibility of that? Basically handling all the hospital business. So they will manage all the department work like finance, operations will be there, public relations will be there, personnel, everything will be looked after by the administrative staff. Now, in many large hospitals, a chief operating officer manages all those activities. Then there will be a huge number of employees who are needed to staff a hospital. Okay, so there will be laborers, there will be some housekeeping staff, there will be nurses, there will be doctors, surgeons, all these contribute to the hospital staff. Now coming to the medical staff, now these are the people who will provide with the medical care for the patients. Now again in this we are having divisions of the medical staff. First is residential medical staff. So these members are available for 24 hours to attend to the patient. Okay. Next we are having associate medical staff. Now these include the physicians allotted to different service similar to the members of active medical staff. Next one is the consulting medical staff. So these include medical physicians who are having a professional identity. For example, orthopedic, nursing, etc. Next comes the honorary medical staff. Now these are people or staff members who are like part-time consulting medical staff. Mostly these people are retired physicians or those physicians who are having clinic and only 1-2 days they come to their hospitals. Next, we are having associated medical service under which we are having medicine division which include all this internal medicine, pulmonary disease, skin and vulnerable disease, geriatrics, pediatrics, etc. This is the surgery division which is having all the departments. Next comes the responsibilities of medical staff which are involved in the hospital. So there is a governing body, as I told you. It is the most essential part of any hospital. So there will be a vice president, executive assistant, department head. Now these people's job is basically to run the hospital, see the budget and finance. They will come up with the hospital policies and procedures and perform other public relation duties. Second is informational service. Now basically all the things like maintaining the records, whatever process information is there, all those things will be done by the informational services like admission, billing, medical records, etc. Next is the therapeutic service. So basically providing treatment to the patients. Again we can organize them like physical therapy, occupational therapy, speech therapy, respiratory, medical, social service, pharmacy. Okay, so physical is what which is used basically to improve large muscle mobility. Occupational is something which we help patient regain their fine motor skills. Speech will be related to the speech disorders. Respiratory is something which is related to heart and lungs. Medical psychology is something which is being related to mental well-being of the patients. Social service is something which is patients. Dietary service includes all the diet which is required by the patients. Then we are having sports medicine and nursing. Next one is the diagnostic service. Now diagnostic is basically determining the cause of illness or injury. So that is something known as diagnosis. So again here we are having different sectors like the medical laboratory which will be studying body tissues, medical imaging like the radiology, MRI, ultrasound, emergency medicine in case of any emergency. Then others like sonography, X-ray, ECG, CT scanning, etc. The next comes the support services, which provide support for the entire hospital. Okay, it includes various things like central supply, biomedical technology, housekeeping, maintenance, and others. Now, this is a detailed review of other services which are performed by any organization. First, nursing service, outpatient service, radiology service, and central supply service. Now, nursing service is something which is a very large department, and it functions for almost 24 hours. So nurses will be assigned for every number of bed, and they are trained for various things like prenatal care, observation, comfort of the patient during labor. Then we are having something known as outpatient services. So all the things which are required by the outpatients will be looked after this particular department. Next one is radiological service, wherein we will be having various equipments like sonography, X-rays, ECG, CT scanning. Next one is central supply services, which are meant for diagnosis, prevention, research, and education. Next comes the hospital pharmacy service. Now the main job of this is to fill the prescription and dispense number of requisition from the wards. So what is the requirement of the patient has to be looked by the hospital pharmacy service. Next is the medical records, which are valuable reference material as they help contain and paramedic staff which are there for evaluation. And lastly, we are having the stores, which will be storing, receiving, and issuing the material against various departments and the wards. Now coming to the medical staff involved in hospital, the healthcare team consists of so many people as we have discussed. So there will be physicians, nurses, social workers, trained dietitians, village health guide, health assistant, and auxiliary personnel. Now let's look into this one by one. So physician is someone who is responsible for the diagnosing and giving a proper medication to the patient. A nurse is a personnel who is involved in the health team. Okay, now this particular nurse will be having its own team. Now there will be a head nurse who is responsible for assigning duties to other people in the group. Okay, then comes the dietitian who will be giving the diet according to the patient's illness. So all those things of food will be looked after by the dietitian. Next one is the physiotherapist who will be assigning the patient or helping the patient with respect to musculoskeletal system. Next comes the social worker who will be discussing your problems like finance, rest, home, accommodation, child adoption, etc. Then comes the occupational therapist who will assist the patient if they are having some impairment of a particular skill, that is therapeutic. Next one is the paramedic technologist who will be there to examine and study various specimens like urine, fecal matter, blood, discharges from the wound. Then comes the pharmacist whose main job is preparation, dispensing the medicines to the patient. Next we are having an inhalation therapist who is skilled in therapeutic measures which are used in care of patients with respiratory problems. And last one is a clinical psychologist who is an important member who will look after the mental health of that particular patient. So with this, we conclude this topic. Hope this topic helps you all. If you all are having any doubts, let me know in the comment section. Thank you.